Good afternoon, ladies and gentlemen. Welcome to the Navigating the New Realities of Care Delivery with TELUS PS Suite EMR webinar. I'm now pleased to introduce today's speaker, Teresa. Please go ahead. Hi there. Sorry for the technical difficulties. Okay, the bridge is now working, so you can go ahead with the presentation. Sorry about that. Thank you.
Okay. Apologies to our audience who have secured this time to hear our presentation, but we'll get right into it now and see what we can get through. Okay. So thank you for your patience. I'll just start off by introducing myself. I'm Teresa Storer. I'm the Director of Implementations here at TELUS Health. I've been with the organization for just a little over 21 years, focused around our client implementations with our newest sites, and now support a team of individuals that work with our clients around those activities. We're delighted to have you with us today, and we hope that you enjoy the presentation. And I'm just going to cover a few housekeeping items. So for better sound quality, we recommend that you connect your webinar with the telephone number that was provided in your registration confirmation. This will allow you to ask questions directly to the speaker at the end of the webinar. Your audio is muted by default, and this webinar is recorded. The link of the webinar will be sent to you in the next few days. Your feedback is important to us as it helps us improve our webinars and address topics that are most important to you. And as such, we invite you to complete a short survey at the end of our webinar, and a window will pop up immediately following. By completing the survey, you'll be entered into a draw to win a $300 Amazon gift card. And please know that your responses are completely confidential. We ask that you use the contact card at the end of the survey to become eligible for the draw. You may have noticed that our webcams are activated, and to change the location of the webcam, hover your mouse over the square icon at the top right corner of your screen, which is currently presented, and you'll be presented with 3 options. We recommend clicking on the side-by-side option for optimal webinar viewing. If you have questions during the webinar, please post it to the Q&A tool. You can access it by clicking on the question mark icon located at the bottom right corner of your screen. Type your question, select all participants, and submit. We'll try to respond to these at the end of the presentation and throughout to make sure that we get to your responses in a timely fashion. Please note, we'll also be opening up those phone lines at the conclusion of the presentation to provide you with the opportunity to ask live questions. Now let's have a look at today's agenda. My colleague, Alison Foster, will do a live demonstration of PS Suite so that you can see how the solution can help you be more efficient, flexible, and responsive so that you can have more time to focus on your patients. We'll also show you how to access your EMR from your mobile device. We'll walk you through the implementation process, and again, we'll give some time for a question period. So without further ado, I'm going to turn it over to Alison, and she will walk you through the demo.
Thanks, Teresa. Yeah, so I'm Alison. I'll do a brief introduction before we get right into the PS Suite demo. So I've been with TELUS for a little over 5 years. Always working with the product and either onboarding new clients, working with existing clients, and now in this case, helping us create custom solutions for our incoming clients as well. So happy to join you today, and I'm happy to show you some of our tools that we've created to address the new daily reality we live in. So as we all know, our situation changed pretty quickly with COVID in terms of how we deliver medical care. Virtual care became our new daily reality, as we we couldn't have patients come into back into our clinics. We had to deal with telephone phone calls and handle all of their care virtually. So what we quickly realized is that to be effective and kind of adapting to this new world, we had to incorporate the remote healthcare directly into the regular processes that you've already established within your existing clinic. So we didn't want to have additional steps, modify workflows. We wanted to actually enhance your existing workflows to support this new remote healthcare that we wanted to keep supplying to your patients. So what I'm going to show you today, again, as Teresa mentioned, is how we've actually incorporated these tools directly into our EMR So I'm going to walk you through a dummy patient encounter using Teresa as my patient to show you how we can communicate with the patient efficiently, how we can communicate with other providers efficiently, how we communicate with other pharmacists efficiently, just so we actually can keep the virtual care delivery model in the most efficient manner we can. So again, I'm going to jump right into PS Suite. I know we had a little bit of a later start today, so I do encourage you to send your questions directly to Teresa, and she will interrupt me as we go along to cover things I want that need to be refreshed or reviewed. And again, if we don't get to your questions during the presentation, we have time at the end, or we'll follow up with you later on as well. So as I mentioned, I'm going to do a mock patient encounter. Before I do that, I need to walk you through some of the most important PS Suite screens that we have, just so you know what we're looking at. So I'll kind of give you a quick tour, then we'll go right into that encounter with Teresa. So PS Suite, it's launched from your desktop, and I want you to consider this as kind of two EMRs in one, because we do have, I'll show you this a little bit later, we do have a mobile application as well that we can use within our laptops, within our computer desktops, but also on our mobile devices and tablets as well. So what I'm showing you here, this is going to be our desktop computer interface. We also have an additional interface that you can use, again, within your desktop as well, but largely from tablets or mobile devices, so you can take your EMR with you. So I'm going to come back to this mobile EMR to show you that interface as well. Just keep in mind that all of these are kind of two options in one as you navigate through the different screens. So from this main toolbar, we have different icons to indicate the different modules of the program. So we have our appointment schedule, we have our patient demographics, we kind of have our next for billing, we have our address book, which is our external communication. So we have our pharmacists, our diagnostic imaging centers, our other providers we're referring to or communicating with. That's going to be in our address book. We have our handouts. Once again, thinking of the virtual care model, we can't quite give our patients a paper handout in our office. We won't want to be able to send them email, fax, or print those new medications, new diagnoses that they want to be educated on. So again, this kind of allows you to still provide that valuable education sheets or the valuable handouts to your patients, even if they're not in the office with you. So a great tool to use in the virtual care world. We have messages. Again, I'll come back to this later on. We'll talk about external communication with providers and pharmacists. That's your internal and external messaging. So internal meaning within your clinic, external meaning outside of your clinic. So everything comes back into one window. And finally, our records. So this is going to be the medical charts we have for our patients. So I'm going to quickly walk you through the ones we'll be working with today, so the appointment schedule. I'll walk you through the records window as well. And then I'll show you how the virtual tools that we developed within TELUS can assist you with a virtual care encounter that I'll display with Teresa. So in the appointment schedule, one thing I want to point out here is how efficient our kind of claim to what we strive to incorporate into our product is ease of use and easy to adapt and easy to customize for your unique needs. So this is the best window to show you how, with a quick keyboard shortcut, with a quick mouse click, PS Suite is really user-friendly and easy to use, but again, just so we can make sure that our clients are successful in adopting and using the system efficiently. So right now we're looking at one provider schedule. I'm looking at a day view. Again, this action bar, I said keyboard shortcuts are very big for us. I put W in for week and press enter. That's going to change this to the week view. Same thing for M for month view, and back to D for day view. This is kind of one of the ways we reflect keyboard shortcuts can be utilized. We also have the ability to change these views based on a mouse click as well. So we have a day, week, month view. Again, I can quickly modify that view, what I'm looking at with the mouse click. So I'm going to pause here and just point out some of the key features of customization. So we have, again, background colors that can be customized per provider. So if you want to indicate that follow-ups happen on Monday morning, during after hours on Wednesday night, these background colors can be incorporated to provide greater visibility of the type of appointments that we're looking to book in those time slots. You'll see we also have different appointment type for colors. So maybe my antenatal visits are going to be purple, My count scene is going to be in blue. All of these can be automated for you and create and customized for your clinic based on what you want to see for your appointment types. So let's get it back to a day view to make it easier to look at. So again, these appointment types are customized with you during the implementation process. And it's as simple as, again, automating the type drop-down. So we can actually default that our consults with the PAP will have a specific color, have a specific time length, have a specific detail to it that they can actually add after the appointment or to the appointment. So to kind of go back and show you how I got there, to book an appointment, I'll book one for 10:30, again, a little bit late, it already happened, but just to kind of show you how easy the process is to book an appointment within the EMR. So patient's name, press your tab key. You can confirm the details from here if you choose to. And here's where that appointment type comes into play. So I can drop down to a specific appointment type, again, customized per provider. So it's relevant to the provider you're booking for. And now, again, will still mean that the colors are changing, the time is changing. I can still add any details I want after that detail line to indicate, again, further reason for visit if I want to free text additional items in. So if I press my OK key, that's going to indicate that, that's going to indicate that that is going to be right in the EMR with that pink color lasting at 45 minutes with for that female physical. So just to reinforce, I'm going through some screens pretty quickly, but if you want to have further questions about the appointment window, about the record window, please send them into the questions Q&A section for Teresa, and she'll interrupt me, and I'll pause kind of partway through each section to make sure that I'm addressing all of your questions as we go through. So just a couple more things before we go into the record window. We can also see a calendar option as well. So we do recognize that people like to use their mouse to navigate. So you can also kind of click through the different days by using this simple calendar option. So again, another option we have for easy to navigate. We can also see multiple providers at one time. So if you have a different pod, if you have different type of specialists, if you have your residents you want to see, we can create custom views that I see different provider schedules in one window. So again, I'm looking at my schedule, looking at all of these 3 other resident schedules, just with a simple click, or even in writing in my initials. So I've got my last name here, press my enter key. That can take me back to my specific calendar. So again, always quick clicks, use the action bar, keyboard shortcuts, just to kind of easily navigate through these windows. So Teresa, are there any questions about the appointment schedule that I should cover before we move on to the records?
We don't have any questions in at this time.
All right, thank you. So I did mention our big strength is customization, suiting to your clinic workflows. So this is another option we have for customizing the appointment schedule, is to change your icons that you use to indicate further reasons for visit or the patient's status as they navigate through or as they kind of travel through the clinic. So if they're arrived, if they're in the room ready, finished, maybe you have an ECG machine, maybe you want to use PPE because they have flu-like symptoms. This can all, again, be customized by you, and we'll assist you to do that during the transition to PS Suite. So I'm going to jump into her records. Again, right at the very bottom, module to module is always accessed from the window you're trying to get to is always accessible from that specific appointment slot. So I want to access her records, right-click, go into that record window. And here is where we have our PS Suite record. So how I want you to envision this is it's one holistic view of the most recent activity for the patient. So think of this in 3 different sections. We have our demographic section up here, including a picture of the patient. We have the patient summary over here on the left-hand side. I can also move that around by putting it near the top, putting it near the middle. I can collapse if I don't want to see it at all. These are all, again, customized as you move through the system to make sure you're using it most efficiently. And just to show you what this is, we have the family history section. We have the current problems, history of past health, current treatments, allergies, immunizations. This is all visible to you as you see the patients. You're, again, fully informed of their medical history and their current problems and diagnosis and their current treatments. So it's nice to open the records, see their demographics, if you choose. I can also hide that. See their patient summary, and then see the most recent activity you've had over here. So this white kind of space we see is off to the right-hand side. That will show you the most recent activity. I can scroll up to see the old activity. So again, if I scroll up, I see the previous days. There's an encounter. There's maybe a lab rec I put in there, so PHE9 score. So everything is accessible with a quick scroll. But when you open the record, you see all of the activity that you've done during the last encounter. So when you watch a PS Suite user kind of utilize this chart option, you don't see them scrolling very much to find information. You see them using other built-in tools to help them find the data that they need. So we have a table of contents, which will allow me to kind of quickly go back to an encounter for back pain. I can see her x-ray by clicking. It will kind of give me my summary of what's inside of her chart and allow me to, again, quickly jump to that specific section of the record. That's one of my favorite tools, is the table of contents. The other tools are the built-in filters on this EMR toolbar. So if I just want to see her labs, just want to see her imaging report, I can click on one of these icons, and it will filter the chart for me to show me just her imaging. And it will also filter the table of contents for me, so I just see that itemized index of the imaging she has inside of her chart. The easy way to kind of navigate, say, look for her consult notes. And the last one I want to show off today is this only notes containing, which is the keyword search. So if I'm looking for the word hands, to see if she's mentioned anything about her hands, I see she has rheumatoid. I can click on that, and that's going to, again, highlight all the times she has the notes containing the word hands in her chart. So that's going to be an easy way to, again, find additional details for us about specific problems you're looking for. Maybe you want to see if you've had a history of headaches with a concussion. You can always look for that specific keyword by opening that notes containing this text. The last piece before I kind of jump into the demo encounter is what we have at the very top, which is toolbars. So these toolbars are one way that PSV can be customized for your clinic. These are your most frequently used tools. So again, I can quickly open up mental health screening forms right from here. And this is actually customized by user or by role or by specific condition of the patient. So if I want to diagnose her with diabetes, you'll see that if I put DM in her problem list, the system automatically recognizes that we should be showing the diabetic tools for your providers. They can quickly access that diabetes form, get the graphs for the A1Cs, get that report card and handout. So this is going to interact. These toolbars are going to interact with the record you're looking at and the user who's logged in to present, again, the most useful tools to increase your efficiency as we go through the program and go through your encounters. I remove that diabetes. Then again, next, that's going to disappear from the toolbar window because, again, no longer relevant because she doesn't have a diabetes anymore or she's not existing in their problem list. So these kind of tools about customization, looking through the data, customizing your profile to see what you want to see in terms of the boxes, this can all be a kind of an example of how PS Suite's been successful because we can adapt what you see based on what you require for your specific needs. So are there any questions that have come in about the record layout, Teresa?
No questions at this time.
Okay, great. So now that you've kind of seen the major windows, so you've seen the appointment schedule, you've seen the records, I'm going to jump right into that encounter with Teresa. So I'm going to conduct a virtual visit with her using all of the built-in virtual care tools that we've implemented. And we're going to start with the EMR virtual visit. So this is going to show you how we've taken our existing workflows and we've actually enhanced them to add to make them more powerful. So with virtual visit, it's integrated directly into your scheduling process, meaning there's no different portals, no different registration, no different schedules to maintain, and it's launched by the provider directly from the EMR as well. So I'm going to show you how to book a virtual visit and how to conduct a virtual visit. And you'll see that, again, based on what I showed you with the first appointment booking, not much is different to make that a virtual visit. We also thought it was important to keep the technology requirements for patients to a minimum. So I'll walk you through what Teresa would receive as a patient and how easy it is for her to launch the visit because all she requires as a patient is an email address on file in a mobile device with a camera microphone, or a laptop with microphone and camera. So hopefully tools they already have or technology they already have. Just want to make sure that everyone could access the EMR virtual visit solution so they can continue to receive their care virtually. So I'm going to close this up. And I'm going to take this Alison Armstrong appointment I've already booked. I'm going to turn it into a virtual visit. So you saw me come in here. You saw me pick her name, pick the physical portion. It might be hard to do a physical remotely, so do follow up. I can confirm her email address she has on file. This is a typical in-person appointment. So here's what we added to make the virtual visit video. So this is the only workflow change you need to make within the EMR to make sure that this visit is conducted through the virtual visit solution. So again, we don't want to make changes to workflows. It's the exact same window. We just enhance our program to accommodate these new tools for you to successfully still deliver your care virtually. So this mode drop-down, again, we instituted that very quickly when COVID hit, just to accommodate these new tools we were adding in. So you can indicate telephone call, in person, or virtual, which I'm going to make this visit right here. So after that has been a virtual visit, PS Suite takes care of the rest. It's going to send the patient, I'm going to use Teresa as an example down here, it's going to send the patient the secure link to connect to the visit. So I'll show you what Teresa received as the patient. So directly in her inbox, she had a no reply, so it's coming from a TELUS Health email, and that's, again, to ensure that they don't get your clinic email address if you don't want it. You get a confirmation of the date and time. We get basic instructions. We get complete instructions, and we actually encourage them to test their connection prior to the visit. So this is going to allow Teresa as a patient to make sure that she can actually utilize her mobile device. She can test her webcam prior to the day of her visit. That's really to kind of decrease the amount of anxiety she has to ensure that she can still successfully connect, and also ensure that you as a provider are not doing a lot of the troubleshooting with Teresa if she does have trouble. The last thing I want to point out is that we do give the patients directly into this confirmation email a 1-800 number that goes directly to TELUS Health, the customer experience team. So we want to support the patient connected to the visit, again, to make sure that you as providers can just focus on the clinical requirements for your patients rather than the IT troubleshooting. So that's kind of a big feature we have as well. We wanted to take on that burden, not the burden, but we wanted to kind of assist your patients troubleshooting their technology issues and let you be the providers rather than the IT specialist. So Teresa's going to press, when she's ready and she's ready to attend the visit, attend your virtual visit directly from her cell phone, and she'll get launched directly into the virtual visit with me with no different registration process, no different kind of apps to download, no software. Everything comes directly from this email and uses her existing device. So I'm going to close this down for a second. And you saw what the patient received. I'm going to show you how the provider starts the visit. So if I want to right-click from my appointment schedule, I can start the virtual visit directly from this window. The same thing happens with the mobile device. You can start it directly from the TELUS EMR mobile application. So I'll show you again closer to the end of the presentation of how they would start that virtual visit from there. So right-click, start the virtual visit. The other option I have is to use the built-in EMR virtual visit waiting room. I'm just going to launch this for a second so I can show you what that looks like. So we actually have developed a waiting room that can show the provider who's an active patient, who's ready for the visit, who's waiting to be seen, and who's finished the visit. So it's going to allow me to kind of see who's logged into the virtual visit solution. And I can actually start the visits directly from this window as well. When I press start, I get confirmed that I have my cameras working. There it is, my microphone's working. And I can press join the virtual visit to see Teresa on that other side. So there she is there. I can minimize this waiting room window and just focus directly on Teresa, or I can leave it open to see if my next patient has already joined the waiting room. So a couple things to point out, see my picture of the way. We also have a chat feature. So this chat feature is helpful for a couple ways. I can tell Teresa links, I can send her a link to YouTube to watch. I can send her technology issues she might be having. I can even attach a file for her to review. So if I want to send her a lab report or an education sheet about her new diagnosis, I can attach that directly through the chat window. From Teresa's perspective, she can tell me things like her family's in the next room, so I might not be able to talk freely about her mental health issues. And she can even attach a photo directly to the chat window for me to upload into her record. If she has a new rash, if she has a new scar she wants me to upload, I can do that directly from the virtual visit solution. So how we typically see our patients our clients utilize the visit is they want to see Teresa's record open at the same time as they see Teresa in the virtual visit window. So if I want to put her chart split screen, I can kind of pull up the EMR virtual visit solution over here and see her record off to the right-hand side. That's going to allow me to see, again, her reactions. I can still make some notes over here based on what she is telling me throughout the encounter.
Allison?
So, yes.
I do have 2 questions that have come in around virtual visit you may be getting to, but I'll ask here. My version of PS Suite shows virtual visit checkbox when booking the appointment. Is that equivalent to your virtual visit drop-down option?
Yes. So the version that I'm running here will be coming to yours shortly in the fall, and as well as the waiting room. So it sounds like an existing client is asking that. So yeah, the checkbox is going to go into the drop-down, and you'll have these waiting room options moving forward. We wanted to update the efficiency and the functionality of EMR virtual visits, so you'll see that coming shortly in the fall.
Okay. And the next question is, does the virtual visit component entail an extra fee? And please remind me how I can change where the patient profile shows up vertically versus horizontally.
Yes, so we'll definitely follow up with you about the cost. That might be something we can save time on for the presentation. And if you want to change the location of the profile, there's 3 buttons down here at the very bottom right of your window. I can change that by just clicking on the different options. There's 3 different options: side screen, kind of split screen, and then at the very top, which is the typical or the classic EMR look. Okay, thank you.
That's it for now.
Okay. Wonderful. So I'm going to I can show her screen full, or her chart full screen. I'm actually going to end the virtual visit with Teresa. And again, same thing, we're going to supply you the option of uploading the chat directly to the chart and saving the start and end times directly to the chart as well. So that's going to, again, allow you to take that the notes you've sent, the documentation you've sent, the links you've sent, and upload it directly back into Teresa's record to make sure that is a complete record of all the documentation you supplied to her. So going back to our next option. So we've discussed virtual visit. That's kind of paramount to having virtual care available to see your patient. Next one I do want to discuss is provider-to-patient communications. So as Teresa kind of showed in the chat, she might not be able to complete a PHQ-9 or a mental health score because her family was in the next room. We want to provide a way to have the patient complete e-forms, capture consent, offer online booking. All this is becoming more important for patients to complete virtually because they can't come into your office to do that anymore. So we have a variety of tools that allow you to kind of do a number of things, including complete e-forms, which is what I'll show you. So these are kind of different options we have to add on to your EMR that can, again, provide further virtual care options. So I'm going to show you how we can actually send Teresa a PHQ-9 form to complete directly from her chart and have it upload directly back into her record automatically. So this Ocean toolbar, I'm going to click on the email button. It's going to open up again in the single sign-on window. It's going to pull in her information from her chart. So there's her email pulled in. It's going to pull in her name. I can choose to send her a secure message. Maybe I see her pap smear is overdue, so please call to book pap smear. And I'm going to request her to complete a PHQ-9. So if I, again, she's here for mental health scoring, want to send that off for her to complete on her own computer, I can press the send button. That's, again, going to send directly to her email address and prompt her to complete that information. So going back to her email, there it is coming through right here. She gets prompted to view the secure message and complete the questionnaire. She has to confirm her birth date, just so we know it's her. And there is that piece called the book pap smear. She can confirm that she's received the message. She doesn't need to view it again. She can print it if she chooses to. I can press my next button, and there is my option for my PHQ-9. Let's quickly complete this. The minute she presses finish, it's going to send her confirmation she's seen the message and her PHQ-9 scores directly back into PS Suite. So there it is appearing automatically, including the message I sent. The patient confirmed receiving this message, and there again is her PHQ-9 score right there. That allows me to, again, graph her scores or have that score directly into a record. This is an automatic process with our value-added services or add-on tools. That's going to allow you to, again, get further communication from the patient remotely rather than have them come into your office, complete it on paper, and put it back into your EMR.
Alison,
yes.
Another question around virtual visits. Do we need to have the client's email address recorded in the chart for virtual visits?
Yes, we do. So again, there's kind of two requirements that the patient has. One is an email address on file, and the second one is a device that has a camera and microphone and internet connection. So that's kind of the two requirements we have. Our clients gave the feedback that the SMS wasn't as important as the virtual visit waiting room, wasn't as important as the photo upload, the file upload. So again, right now it is based on an email solution, but we do have the feedback that maybe a text reminder would be a good thing to consider in the future as well. So yes, it is email based. Right here in the patient demographics is a spot to record their email. Any other questions?
Nope, not at this time.
Okay. So I'm going to quickly run through an account, just show you one type of a template. I'm gonna show you. I'm gonna discuss prescribe it and show you prescribe it, and then discuss med dialogue, and then kind of quickly show you the mobile app and how to do this all in the mobile app, and then hand it back to Teresa to walk you through the next steps as well. So under the quick visit, I'm going to open up my cough quick visit. Maybe Teresa had a cough on the phone she mentioned. This is a template that allows me to kind of quickly put in the history of past health or illness, so 7 days. It's dry. I can put in my N's or my Y's for yeses and no's. I can skip fields that aren't relevant to Teresa. Same thing, I'm using this with my keyboard, or I can double click with my mouse to toggle through the options. I'm just going to quickly do a couple of them. The reason I wanted to show you this is because, again, customization of PS Suite is going to increase your efficiency. So this is one example of how our templates are kind of prompting you through some clinical guidelines. If I click asthma, we get the asthma treatments popping up. Whereas if I click pneumonia, I get the pneumonia treatments popping up as well. So these templates, again, similar to the diabetic toolbar that appeared, it's going to interact with what you're selecting on the form to present you the most suitable kind of clinical treatments in this case. Also, in order CBC, I'm also going to incorporate my billing and tell her to return if it gets worse, and there's symptomatic relief. So keep in mind that I've only selected a couple of these. I'm leaving the rest of them blank. But when I press my finish button, it's going to summarize all my activity and present me with the bill for the visit. So there's my bill book. Sorry, go back to here. There's my bill book for asthma 8007. I can save or cancel that one. I'll cancel that now. Here's my subunit prescription. I'm going to put that to the side for a second. Here is my CBC lab rec already selected because I wanted to order that for Teresa. And this window right here, or this progress note, summarizes all of the options I picked and makes it into an easier to read progress note directly in the EMR. So rather than reading that form base, we actually create this summary note for you. So again, next time you receive Teresa, you get that nice, easy copy of the symptoms and the assessment. So all of these templates kind of bring this lab recs, bring in the messaging, bring in the billing, the prescriptions you're going to provide directly into your window for you, so you don't actually need to go looking for those tools. So Prescribe It. I left my prescription open. I do want to discuss Prescribe It for a second. Prescribe It is a solution that's a national e-prescription solution, but it's so much more than just the prescription. It sends over discrete data. So it sends over patient demographics. It sends over Teresa's allergies. It sends over any of the interactions I manage as her prescriber. It sends over any of her heights and weights I have on file. So if it's weight-dependent dosing, the pharmacist gets that information as well automatically. So going out from the provider, I can do that directly from PS Suite, again, not changing my workflow for a regular prescription, and I can actually receive dispense notifications from the pharmacist, meaning what was actually dispensed and when, and I can even receive e-renewal requests from the pharmacist directly back into my EMR, so I can just press approve, deny, or even reject or modify at that point. So Prescribe It kind of increases the partnership between providers and pharmacists because it's going to, again, provide that greater communication tool to send information back and forth from these two providers. This is a complimentary service for our clients. And again, just to point out, again, the most important thing to us is not changing your workflows. We just want to add to your workflow. So I'm going to use a favorite here. And typically, when we want to send off to a pharmacist, we can see that the preferred pharmacy is up here. I can use my drop-down to select the e-prescription or select a different drugstore. So if it is not an Prescribe It pharmacy, I press my fax or print button. If it is a Prescribe It pharmacy, I press my e-sign and send button. So again, no changing to workflows. We just want to enhance your workflow to send over that greater information. So I'm going to e-sign and send. That gets submitted, again, to the Prescribe It solution. I said it was e-prescribed, and it also sent off her allergies, which she doesn't have any right now, sent off her demographics, sent off any heights and weights I recorded, and any interactions I recorded as well, automatically with that subunit frequency and dose. So it kind of takes all that information and sends it along with the prescription, so the pharmacist has a greater picture of what the different types of issues they should be aware of, or the data that they need to be aware of before they dispense that. So Prescribe It, again, if you want to learn more, we definitely recommend going to Prescribe It, or we'll follow up with you directly, but it is a complimentary service for our clients. I mean, it is a national e-prescription solution that we definitely encourage you to adopt because it is saving a lot of time, creating greater efficiency for your clinic, and also sending better information across to your pharmacist. I'm not going to show this one. I just want to talk about provider-to-provider communications as well. Kind of the same idea. Take your existing workflow, which might be fax-based, and just enhance that to send over the discrete data to other healthcare providers. So if I write a letter to a provider, maybe it's a referral letter, I get to send over the discrete data from the patient's chart directly to the specialist or the other provider you're referring to. Same thing, I can even send them a message rather than text your friend or text your colleague or call your colleague for kind of an assistance or a question. I can send them directly from PS Suite a message, similar to I do to my internal staff, to ask them their opinion on the lab rec you've received. So it's not only just an e-consult solution, it's also a messaging solution as well for those in-between kind of questions you need to have clarification on from your colleagues. So MedDialogue is our provider-to-provider solution that, again, is going to further automate and increase the collaboration between providers and the care team. So, Teresa, any questions about Prescribe It or MedDialogue?
No questions at this time.
Okay, so I think what I'm going to show now is I'm not going to hand it back to Teresa just yet. I'm going to show you the mobile application. So again, as I said, we have an option to kind of run I call the desktop version, but we also have the option to run the TELUS EMR, which can go on your mobile device or tablet. So what happens, it gets onto your iPhone or your Android phone. You kind of download it from the App Store, and you actually just point your phone, if you point your phone camera at PS Suite, and it'll actually pair your EMR your phone to your EMR in your clinic. So it's the same data we're working on. And what it will look like on your phone, which is say the big form version, so it's easier to see. I can still get my schedule. This is, again, matching my schedule I have inside of PS Suite, so it's the exact same data I can see. So there's, again, 2 different ways to look at things. I can even add appointments from here if I choose to. So if you have to see somebody remotely, you want to add an appointment from your cell phone, you can do that through the mobile app. We have my larger calendar, and I can even look up patient files from here as well. Going back to Teresa's record, if whoever's looking at, I can see her progress note. So there's that treatment I just started that went off to the Kroll Pharmacy. There's my progress note I have done already, so I can see her encounters. I can see her labs. I can see any messages she has done, and I can see her medical summary. So here's that active problems, current medications, allergies, procedures. All that's visible to me directly from my cell phone. Finally, we have our options to add items. So that's where we can prescribe, add notes, or send messages to right from our mobile device. So I went through that pretty quickly. Again, I know we had a later start, but I'm going to pass it back to Teresa now to walk you through the implementation process. But again, keep sending questions in if you want me to address those at this point, or even after once you ended the seminar. I'll follow up with you later privately if you want to get questions in.
Thanks, Alison.
Thank you.
All right. Okay, so we're going to walk you through some of the implementation activities and what that will look like should you choose to join the PS Suite group of clients. So once your order is received by our implementation team, we start the process of reviewing the details of your order through our intake point, and we scope and evaluate all the details that were discussed at the time of sale. We assign one of our project managers who will reach out to you. They'll be your point of contact as they begin the project kickoff process, and they assemble the TELUS EMR learning team. Along with the PM, the project team will include a learning specialist, will include a clinical and data analyst, and professional service engineer, all who are professional service engineer being specifically the server configuration expert. All of these team members work with you through the implementation from the start and through to go live. We, of course, will look at your unique needs and adjust the project based on your circumstance. So, for example, if you have a paper-based system today versus a fully electronic data migration requirement, we'll incorporate that into part of your project plan. Our PM will also arrange for a clinic needs assessment with one of our learning specialists, and they are the individuals, the product experts that will work with you to understand any of your unique workflows from your practice and to guide you and them through the development of your customized training plan. Our data team evaluates the data size and the mapping requirements to align with the expectations of the environment, and they provide you with a test environment prior to the live migration. Throughout the entire implementation process, our team focuses on delivering the EMR with minimal downtime, ensuring that you're able to see and take care of your patients as quickly as possible. Our team will help and support you in the first few days post-go live to ensure your team's success in the clinic workflows and operations, and also helping remove those first few day jitters that occur with a new system being implemented. As you use your system in the first few weeks of go live, our PM will continue to be your point of contact, and certainly they'll help you transition to the next level of client support when you need it. They'll introduce you to the processes in connecting with our client experience organization, and from there your implementation is complete and you're successfully utilizing PS Suite within your practice and with your team. I'm going to pause there for a moment to see if there are any additional questions before we move on. No questions in our Q&A tool, so we'll move on, Alison. Okay, we're coming to the end of our presentation, and so we have some reminders for you. As you can see, before we end the call, we'd like to remind you to kindly fill in the short satisfaction survey, which appears when exiting the WebEx. We enjoy reading your responses and discovering new ways to improve these types of presentations. And by doing so, you'll automatically be entered into a draw to win a $300 Amazon gift card. So remember to fill in that contact card detail. The webinar is now coming to a close, and we hope that you found the information very valuable. Sorry, there's one more slide there, just giving you a visual as to what you should expect when you exit the survey. You'll have a reminder to click continue through to the survey site, or you can just scan in the code to the right of that screen. So before we close out, we're just going to give the floor, or open up the floor, if Mike could do that, to give you time for questions and answers.
Yes, so again, if any participants would like to ask a question, please hit 01. If you'd like to withdraw your question, you could hit the number sign. So again, it's a 01 to ask a question. Thank you.
So in the meantime, again, if you want to continue to send your questions to the Q&A tool, Teresa can read those out for us in case you just joined on the broadcast, haven't dialed into the phone yet. So we are looking at both the Q&A tool and the mic on the phone line as well for questions.
Allison, I do have one that's come in on the Q&A. What devices support EMR mobile, and what functionalities are available? Is it a fully functioning EMR?
So in terms of what devices support it, so anything that runs on an iOS or Android system, so iPads for tablets or iPhones, or any of the Android tablets or phones, that's going to be supported. And some of the functionality you'll see is, if I open this up again, is, again, seeing your calendar options. You can add appointments. You can access the EMR virtual visit waiting room as well. So if you want to conduct a virtual visit from your phone, you can click on the appointment schedule, or you can open up the waiting room directly from here. And again, if I want to see Teresa's chart, click on that. I can see her follow-up visits. I can add a new note to her chart. I can add a prescription to her record. I can compose a message to my peers to have her recall them for an appointment if I choose. But I think one thing I can't show you on this computer is the ability to take pictures. So again, we realize that taking pictures is so crucial to your care that we've given you the tool to do it through virtual visits. But also, when you go back to in-person encounters, or maybe you're a year, sorry, I don't make assumptions. When you have an in-person encounter, you can use your cell phone, kind of open up the mobile app, take a picture of Teresa's scar or rash. It will automatically upload directly back into her record. So it won't be stored on your phone. It's kind of the device that we use to upload photos or documents to her chart. That's one of the biggest features we've seen utilized in the EMR mobile app. Other things, you can actually review lab work. So we can see the labs that have come in. We can categorize labs if we want. We can improve labs. We can see our e-prescriptions that have been requested from us as well. So all of that is accessible directly through the app. So while it might not be, we're working towards making this kind of plus sign a full EMR. We're building in all the different tools as we go along to make sure it is a full EMR in your pocket. So right now, for example, there might be a limitation in terms of custom forms, but we find that we're slowly adding all the tools back into to this based on the priority or what the functionality is that our clients are asking for first. So prescribing was a big one, notes was a big one, pictures was a big one, checking messages in labs was also a big request from our clients. That's kind of where we started, but we are working towards the other tools being added to this mobile app.
Thanks, Alison. Before we go to the audio for questions, there's another one that came in related to the mobile app. Does information get cached temporarily stored in a mobile device?
No, nothing is stored on your mobile device. Everything is everything is using what we call an API here. That nothing is actually stored on your physical device. Everything is stored directly back into the EMR. So when I take a picture, it's not in my photo or my camera roll. It's not, I can't look at it again once I've closed out the photo. Everything is directly into PS Suite for safekeeping and for, again, that's to make sure that nothing is left on your personal devices and the personal health information. So nothing is stored on your device.
And a top-up question coming in. Does the mobile app cost more?
No, that is, again, we realize it's important to take your EMR with you wherever you go, so that is a complimentary application for all of our clients as well.
Okay, so I think we've gotten the questions on our Q&A tool wrapped up, and if there are no other questions, we'd like to thank you for your time. We're ready to wrap it up.
Thank you, everybody. Thanks for joining. Have a great rest of your afternoon.
Thank you.